This is CB, an 88-year-old Caucasian male with CHF, chronic kidney disease, stage 3, GERD, neurogenic bladder, hypertension, and UTI. He lives with his wife at a assisted living facility and has 4 sons, and he sees them often. Even though he had multiple recent admissions, there was still an unclear etiology to his CKD. So in September 2018, he was admitted again for acute worsening of renal failure, increased weight, shortness of breath, edema, bilaterally lower extremities, worsening systolic heart failure, and he had complaints of abdomen pain, anxiety, dizziness, increased weight, and swelling. CB's signs and symptoms included dizziness, confusion, nausea, edema, anxiousness, trouble sleeping, shortness of breath, increased weight, abdominal pain, and itching. He's currently taking 2 medications for his edema and 2 medications for his anxiety. This is a little bit about CKD. Some leading causes include diabetes, smoking, and hypertension. There are 5 stages to CKD, and CB is included in the stage 3. Stage 3 includes mild to severe loss of renal function, and it presents with edema, fatigue, and a GFR of 30 to 59. As you can see, I have an asterisk next to stage 3. I found on CB's labs that his GFR ranged from 17 to 20, which is actually under stage 4. Stage 4 symptoms include all of stage 3's, and also weakness, nausea and vomiting, sleeping problems, difficulty concentrating, kidney dialysis, and then a renal dietitian is also needed, and you also find lower blood count as well. Clinical manifestations of CKD include all these systems listed here. Under metabolic disturbances, as the GFR decreases, BUN and creatinine levels increase. So for CB, his GFR is 20 and his BUN was 89 and his creatinine levels was 3.03. Under cardiovascular, CB has hypertension, and that can be both a cause or can be a consequence. And he also has CHF, which is related to his edema and his increase in blood pressure as well. For respiratory, CB was having complaints of shortness of breath, and for GI, he was having complaints of nausea. He was also experiencing a lot of itching down by his feet, and he also was having trouble sleeping, which goes under the neurological, and he also was showing a lot of signs of confusion and also signs of anxiousness. Under his labs, there were a few electrolyte imbalances, so he was showing signs of hyperkalemia and hypernatremia. Some nursing interventions for CB include encouraging him to be adequately hydrated, assisting him when he has signs of itching. When I was with him, he complained a lot about the itching on his feet, so I used a lot of anti-itch lotion, and he said that it helped a lot. Also assessing his output and his color of his urine, assisting him when he had signs of anxiety by decreasing stimuli. He was very triggered by a lot of stimuli, so noise in the hallway or on TV, so turning off the TV or just turning off the noise helped him a lot. Also assessing his electrolyte imbalances and ability to ambulate because he was experiencing a lot of dizziness. Some patient education includes importance of hydration, following a diet appropriate for CKD, consistent medication administration, and communicating his signs and symptoms to any nurses or family members. Going along with the goal of adequate nutrition for CKD, I found a nutrition guide that is from the renal dietitians through the Academy of Nutrition and Dietetics. Okay. It's important to let him know that CKD causes the body to have trouble getting rid of extra nutrients, toxins, and fluids, so there are a few nutrients to keep in mind with having CKD. So first up, protein. It's better to have a lower protein diet to prevent CKD from worsening. Number 2, potassium. A low potassium diet is better because having too much potassium can prevent the heart from working properly. So staying away from bananas, avocados, oranges, spinach, and a lot of other fruits and vegetables. A low sodium diet can help prevent excess fluid from building up, which also coincides with the edema and shortness of breath that CB is experiencing. So that would be staying away from seasonings with salt, canned soup, soy sauce, fast foods, and salty snacks.